Today we're here to talk about the Affordable Care Act, some of its milestones and the benefits to the people of the United States, also some of the critiques that have come up over the last few years and the last few months. You know, the Affordable Care Act succeeded in doing a few things. The United States for a long time has been the wealthiest nation on earth. However, millions and millions of Americans, despite our country's wealth, have been unable to get health care insurance. Many folks have suffered a very long time, either themselves or their family members, not being able to see the doctor when they need to, being kicked off of insurance because they've hit lifetime caps. College students have gone without insurance for years because they could no longer stay on their parents' plans. The Affordable Care Act has done several things, and there was a discussion earlier on the floor, I think during the lunch hour, and there was a question raised about by one of the Republican members, and his question essentially was, what has the Affordable Care Act done? Well, there are several things, concrete things, that it has done for the United States. The first is that 3 million students have been able to stay on their parents' insurance plans where they otherwise would have been kicked off before. The average age where students were kicked off before was about 19. Under the Affordable Care Act, millions of college students can now stay on until the age of 26. We know this number, 5 million people so far and growing, have signed up for health care insurance through the exchanges. 5 million Americans. That's very significant, and that number continues to grow as some of the busiest days for the healthcare website, for the call-in number, have been over the last few weeks. Also, 4.4 million Americans have signed up for health care through Medicaid. They've been now covered through Medicaid expansion. Now, we can talk about the fact that some states have decided not to expand Medicaid, so millions of their people, including in my home state of Texas, have not been able, low-income Americans. Most of these are people who are going to work every day, working hard to support themselves and their family members, who are still low-income Americans, but because the state governments have not expanded states, they've not been able to get covered, and so we're going to talk about that. And then another issue I want to talk a little bit about is something that is very significant for millions and millions of Americans, and that is mental health parity with physical health. For years, we tried in state legislatures, I know I tried in Texas, and people across the United States have tried to make sure that mental health issues are covered by insurance in the same way that you would cover a broken arm or a broken leg or cancer even. Millions of Americans suffer from anxiety, from depression, from a slew of mental health issues, and previously they were unable to get covered. So those are some of the issues that we're going to talk about this evening, and right now I'd like to yield to my good friend, Congressman Gene Green from Texas.
Well, first of all, I thank my colleague from San Antonio, and we're both Texans, and we know the problems. And you served a lot of years in the state legislature, and I did too. And frankly, a lot of our problems, I think, could have been dealt with if Texas would have expanded Medicaid. And we're actually giving back money to the federal government and not covering children and families in our community because of that. And frankly, even with the problems with the rollout of the Affordable Care Act, I know some states have done a great job. Kentucky, California, some states haven't. But I would think that if Texas did their own exchange, we could be the ones making those decisions. And I think particularly with the Medicaid expansion. But I appreciate you asking for the special order tonight because we're coming up to the deadline of March the 31st. In fact, I have to do a commercial first. A lot of us have done these events on how people can sign up for the Affordable Care Act. I have one that we're sponsoring this Saturday at the Harris County Department of Education building at 6300 Irvington Boulevard in our district. And with some of your former colleagues, State Representative Armando Wiley, State Representative Jessica Farrar, our relatively new State Senator Sylvia Garcia, and our City Council member Ed Gonzalez. We're doing that this Saturday from 9 to 1 to where people can come in and sign up. The success, though, is that the website was down for 2 months, but we've seen just a huge number of people signing up. At 5 million as of last week, and I hear on Monday of this week they had 1 million contacts, both by phone and to the website. So there's a need out there for the Affordable Care Act. It's landmark health care reform. I was on the committee, the subcommittee and the committee to help draft part of it, the Energy and Commerce Committee. And we did nights and days of drafting amendments, and we had both bipartisan amendments that were adopted to that, including one of them was on mental health that Congressman Murphy from Pennsylvania and I had worked out to expand mental health coverage. Of course, we live in a two-cameral Congress, and sometimes the Senate doesn't always do what we would like to do on the House side, but that's the nature. But the Affordable Care Act is expanding health care access. And you mentioned some of the successes that we have. I know as a state legislator, I would have loved to have a state law that required insurance companies to pay 80% of their premiums that they receive back as benefits. I don't know of any state that does that. I would have loved to have that in Texas. So somebody who pays a premium, insurance premium, whether it's employer health care or individual health care policy, they could be guaranteed that 80% of their premium will come back in benefits. That's what the federal law is. We hear our Republican colleagues say, oh, they still haven't come up with an alternative to the Affordable Care Act because they can't. That's one of the successes in there. And there's a lot of successes. In fact, some of that law is actually Republican ideas that have been built up over the last 20 or 30 years saying, how can we cover the uninsured in our country?
Congressman, once upon a time, these were the ideas of the Heritage Foundation. This was a conservative movement, conservative ideas about how folks would take individual responsibility, because as you know, being in Harris County, our large hospital systems end up with millions of dollars in uncompensated care every year.
Yeah, our Harris healthcare systems now, our Harris County Hospital District is our catchment. But not all counties in the state of Texas have that option to have a hospital district. But even in our area, I have a district that's one of the highest in the country of people who work who don't get insurance through their employer. That's why the Affordable Care Act is important. In our district, we have 261,000 people estimated who would have opportunity to get health care through the Affordable Care Act. And we're hoping to sign them up. We started in November, and we've had these workshops literally all over our district in partnership with lots of different groups. The Affordable Care Act, and particularly in our district, because we have one of the highest in the country of people who are uninsured. It's essential people know that the financial assistance that's available under the Affordable Care Act that can lower their health care costs. In fact, nearly 6 of the 10 uninsured people will find that they can find a health coverage for $100 or less a month. Like I said, this Saturday we're having a forum, but this forum is a great opportunity for people to come and actually learn about health care options because health care insurance is important. Our country, after World War II, made a decision. The country we built in Western Europe had government-run insurance. Canada has government-run insurance. Our country decided to go with employer-based insurance, and that worked well up until about 10 years ago and 12 years ago, where we started seeing employer dropping that coverage. At one time, our country, 80% of the people who worked had insurance through their employer, below 60%. And it's getting worse. Although the Affordable Care Act, we're actually seeing increases in that, because even a small business can be eligible for subsidies to cover their employees under the Affordable Care Act. And like I said, as a member of the Energy and Commerce Committee, I'm proud of us passing something. It's not perfect, but it's a step in the right direction. And I would hope that this Congress and maybe a future Congress say, okay, let's see what's wrong with the Affordable Care Act. Just like we've had to go back and fix Medicare on a number of occasions. Right. Nobody wants to abolish Medicare. It's one of the greatest legislation that we've ever passed. And I would hope that over the years we would not only build on the Affordable Care Act to make people, just like Medicare, know that they don't have to worry about putting their families in bankruptcy because they have an illness. And the Affordable Care Act will help us on the road to protect that. And I appreciate your leadership tonight on this.